Hello and welcome. My name is Barkha Dutt. You're with the Mojo Story. Our focus continues to be on the COVID pandemic and its aftermath. And the good news for once is that finally Covaxin, the Indian-made vaccine, has released its phase 3 trial data. The company says that Covaxin will offer 77.8% protectiveness against symptomatic COVID. Now remember, there has been a great deal of delay in the release of this data. The company further says that 65.2% protection is offered against the Delta variant, which has been the variant that we have seen in the second phase. The World Health Organization is still to give approval to a Covaxin, and that is because this phase 3 trial data was missing. It is now out, and we have to see as and when the WHO actually signs off and approves this vaccine. Questions, however, remain about the volume, the manufacturing capacity of Bharat Biotech. Many questions arise from the centre's own affidavit on the vaccine supply in the Supreme Court. To understand these figures, exactly what they mean, and whether this is good news, of course it is, but how far does this good news travel? Are there any ifs and buts that we should be aware of? Let's bring up our panel of experts today on the program. Dr. Ishwar Gilada is with us. Thank you, Dr. Gilada. We were just talking yesterday with you about the initial hesitancy over Covaxin, because remember, people had to sign consent forms before it was given in the initial stages. Now, hopefully, we know a lot more, and we'll talk to you about that. Dr. Rajeev Jayadevan of the Indian Medical Association joining us from Kerala today. Dr. Shahid Jameel, one of our foremost virologists and experts, is with us. Sumaiya Shaikh, Dr. Sumaiya Shaikh is with us, a neuroscientist as well as a journalist. And we're also joined by Dr. C.S. Pramesh, who's the director of the Tata Memorial. Thank you, everybody. And let me start with you, Dr. Pramesh, if I may. Obviously, good news, but if you had to decode the data more, what would you say stands out, for you?
So, as you said, Barkha, this is extremely good news. The fact that we finally got the phase 3 results of the Covaxin trial, which was long awaited. So the biggest news is that it gives close to an 80% reduction in the risk of symptomatic COVID, and close to a 95% efficacy against serious illness. So to me, this is a major breakthrough, and the fact that we've been using this in India so far has got validated by these results. I wish these results had come in earlier, but nevertheless, it's good news for us, and it gives a lot of promise in the fact that we will probably be able to vaccinate a lot more patients in India as well as in several other parts of the world. I know for a fact that Brazil had some misgivings about the results. The WHO had some reservations about accepting this even in the EUA solution. But this is really good news, and I'm hopeful that this will, to a large extent, reduce the vaccine inequity and the vaccine injustice that we have currently worldwide.
Shahid Jameel, though, if I'm not wrong, this efficacy, these numbers that we have, is for 2 doses of the vaccine. So we don't actually know, or maybe I don't know what happens after a single dose. Is that something that should be worrying us at all?
Well, no. The way clinical trials are done, you really calculate efficacy after a predetermined number of cases. And if you recall, Covaxin, we had interim data come out after 43 cases, then after 87 cases, and then now finally after 130 cases. So these are the endpoints that had to be specified in the clinical trial document. So they can't stray from that. I think what you are saying, Barkha, will be tested in the real world efficacy of the vaccine. And unfortunately, there isn't any real world efficacy of Covaxin as yet. There are a couple of studies from India, but they have not really separated between Covishield and Covaxin.
Can you explain what you mean by real world? Because
Real, right.
Bharat Biotech says that the phase 3 trial is in fact from 130 symptomatic COVID patients. This is what my
Right.
understanding is. So is that not real world? What do you mean by real world?
Well, this is a clinical trial, which means it is done under very controlled conditions. Real world is when you and I take the vaccine, who are not part of the clinical trial, and the vaccine is rolled out in a population. Different things happen. Sometimes, cold chain is not maintained as well as it should have, and all kinds of things happen. So that is the real world effectiveness that we talk about. And for both AstraZeneca vaccine and Pfizer vaccine, Public Health England and several other studies have come out, which is the post-vaccine rollout studies from the population. From India, I'm aware of a couple of studies, but none of those studies break it down into Covaxin and Covishield, simply because only 10% people have had Covaxin so far. So the
Yeah.
numbers were not enough. And I'm sure as more vaccine is rolled out, we'll get those numbers.
Dr. Pramesh, is that something that concerns you, the absence of real world data? Because Covaxin has been so late also that it's made it a little bit more complicated to get this data. We're literally after the second wave now, or we hope we're after the second wave.
So in an ideal world, we will have real-time, real-world data, but we don't live in an ideal world. So I can live with that. I can accept the fact that just like for the other vaccines like Pfizer, Moderna, and the several other vaccines that we are accepted so readily, we will go by the clinical trial data. But getting real-world data is extremely important. And considering the fact that the most of the data is controlled by the CoWIN app as well as the ICMR. It's just a question of marrying the two so that we get real world data. And this is especially true with the Delta variant, because this was not something which was apparent when the clinical trial was actually run. And I would look forward to more data from this before we actually come to some concrete conclusions.
Dr. Gilada, in a separate context on this program, just yesterday, you were making the point that in the initial stages of the vaccine rollout, Covaxin had raised all kinds of doubts, not just among ordinary citizens, but even among doctors. You said there was a hesitancy in doctors in the medical community, primarily because at that stage it required the signing of a consent form to actually be vaccinated by Covaxin. Do you believe that with this data out, which is frankly been delayed for reasons that are not clear, and we still don't know, that hesitancy will end? So you're on mute.
There is,
Yeah.
yeah, okay. There is no delay as such, because if you look at the clinical trials of Covaxin and Covishield was already tried abroad, so therefore they were allowed to have a bridge trial. So it was a very small trial of 1,600 people, whereas Covaxin has done a trial in 25,000 plus people. So it's one of the largest phase 3 trial. Secondly, when the license was given, it was one vaccine, Covishield was emergency authorization mode, and the second vaccine, Covaxin, was in clinical trial mode. The moment you said clinical trial mode, that means people are hesitant to go for that trial, because it is not a trial. You are taking vaccine from somewhere, but you are still signing a consent form. And therefore, as it is, they still have that mentality that we are ruled by Britishers. We think that something coming from abroad is better than what is made in India. And that hesitation was also there. So now with the data out, and what it shows clearly that it has been advantageous in 3/4 situations. One is it has very less adverse effects as compared to Covishield. It has a protection from Delta, which is almost 65%, and it has 93% protection from symptomatic infection. And not a single death is associated or recorded with the trial data. So with the Covaxin, with this four, I think we are in a good situation. Initially, what we thought that people were not listening to a Prime Minister saying that we should become Atmanirbhar Bharat. Virus listened to it. We made a Delta virus which was Atmanirbhar, which was 99% of our all cases were Delta virus. Now we have Atmanirbhar in real sense that we have a vaccine which is
Well,
R&D done in
well,
India.
it's fantastic that we have an Indian-made vaccine, but I'm afraid that I have to disagree slightly by saying that while the Indian vaccine was being developed, if I were in government, and clearly I'm not, I would have still gone ahead with the purchase of foreign-made vaccines that had an established track record. But that's a different debate. We do have an Indian-made vaccine. The results are out, and I want Sumaiya to come in on whether there's anything which is a cause of concern. I want to turn our attention to a certain commentary that has come that we don't know how this performs on older people. There have been some questions raised about that. Secondly, very interesting data point is the efficacy for asymptomatic patients. Bharat Biotech is arguing that none of the other vaccines are actually offering protection against asymptomatic COVID patients. So I'll start with you, Dr. Sumaiya, and then to Rajeev.
Hi, Barkha. Thank you for having me here. So they're claiming that none of the vaccines are offering protection against asymptomatic cases. But as a matter of fact, you will have some asymptomatic cases in the vaccine group. So, for example, in this particular data, there were about 24 cases of asymptomatic infections in the Covaxin given group and about 106 in the placebo. So yes, it is offering protection, which a lot of the vaccines are also offering protection, but it is not 100%. It's 93.4% according to the data. So I think we should always stay away from calling it an either-or arguments. It's always like there's a nuance to it, and that is the case with all other vaccines as well. I mean, yes, the data is quite nice, brilliantly coming. I mean, it was about time that it got released. But the second thing that I am, it's not a matter of concern per se, but it's the way the science is conducted in India, and I don't want people to kind of take this and like shy away from the vaccine. I absolutely support taking any vaccine that is available right now in India, whether it's Covaxin or Covishield. I think one of the things that always has bugged me is about the conflict of interests here. I mean, the data is out, the data is brilliant, but the people who are owners of the company, they're Bharat Biotech's owner, Dr. Krishna Ella, and everyone's on the paper itself. So, and they're the manufacturers. They're like, so this doesn't happen in other vaccines. What has happened in this particular vaccine is very unique. But at the same time, nobody.
Can you explain that? Can you explain what is unique?
Yes, so this is a conflict of interest in the people who manufactured it, who are benefiting from it financially, and at the same time are on the paper, are on the studies. They are the ones conducting the studies. So you know how AstraZeneca was developed by people in Oxford, and then it was taken by AstraZeneca and then distributed it further. They were the ones who were manufacturing and profiting from it, but it was actually done by the public money. So what should have happened is essentially an independent person or a group of scientists from a public university. They have no financial gains within, but that is true. I mean, this is again another nuance that I'm adding. I absolutely agree that the data is fantastic and the vaccine should be given. This is just in good science that we should have these particular practices in place, and the vaccine should not be criticized per se because of this incident. This is just a political side of science. But yes.
Fair enough. Shahid, before I get Rajeev, would you like to respond to that? That this auditing, as it were, or the appraisal, as it were, should have been done outside of the company that was manufacturing it?
Well, it's always good scientific practice to do that, but I must say that the paper clearly states the conflicts of interest that are there. So it is for the reader to read it and analyze it accordingly.
Why do you think it took them so long, Professor Shahid Jameel? Why do you think it took them so long? Why have we? I mean, I know it's in the past, but it's in the past only as of 24 hours. And this delay was severe enough for Dr. Mulyal, who's a part of the COVID group, working group, to say to me in an interview that he thought that the government needed to set a deadline because it was taking so long.
Well, I don't know why it took so long. Maybe the data analysis took time. Maybe reaching to the 130 number took time. There could be many things. I can't answer that. But the fact is that the data is now out and it looks really good. And if I might add, this is possibly, if I'm right, this is the only vaccine that actually in a clinical trial has efficacy against Delta. No other vaccine in a clinical trial actually showed that. So that's a big positive, and that was fortuitous because, this trial follow-up period fell at a time when India went through a second wave, and we had a lot of Delta infections.
Well, the other vaccines then have not shown up their efficacy in the clinical trials because Delta came after those trials, right?
But they have shown real-world efficacy.
That's right. Rajeev, let's bring you in. How do you read the data? One of the data points, of course, is that the efficacy reduces in the 60-plus age group, but maybe that's natural in terms of older people being sort of more immune, less immune. I beg your pardon. Rajeev, go ahead.
Yeah, to me, this is a triumph of science. The way I see it, I was one of the first to actually write about Covaxin and as to why it should be a perfectly safe and perfectly effective vaccine many months ago when, as Dr. Gilada said, there was plenty of what's called hesitancy in local circles. Now, I wrote it as a scientist, and that is as a man of science. It made perfect sense that you make a vaccine pretty much like the way it is made. It's been made for a very long time. So I laid the facts out. So I'm glad that in one sense I was proved right, in the sense the results are good. And on a larger scale, in one sense I'm relieved that this actually completes a big picture. That is, all vaccines are effective against severe disease, and that is a powerful message that this trial comes out with, and which is basically what many of us have been speaking on multiple forums, particularly to the public. See, the public tends to get confused with multiple numbers, 60%, 70%, like CBSE marks. But what really matters is their ability to prevent severe disease and death. And this is compelling data. What Covaxin has come out with is compelling data. And what impressed me is a couple more things on this trial. One is the fact that it has some information on how good is it to prevent asymptomatic disease. Now, when you're at work and your colleague is vaccinated and you're vaccinated, you want to be sure that it's a safe working environment. Now, if you know that the vaccine that they took is effective against asymptomatic disease, it gives you a bit of an assurance that they're not going to silently pass around the virus without anyone knowing about it. See, asymptomatic transmission is a worrying factor in this pandemic because this particular virus transmits efficiently the day before symptoms appear. And to make it worse, if asymptomatic people can transmit the virus, we can never stop it. So this vaccine has shown some efficacy in that regard. And the second good part, again, is that older people have been studied in sufficient numbers. Remember when AstraZeneca's trial came out, they were severely criticized for having fewer than 1,000 people who were older. But now we have sufficient numbers of older people that they've studied. I think 11% or so have been studied, and a good efficacy has been demonstrated. And remember, this is a segment that actually have severe outcomes or bad outcomes from the pandemic. So it is this group that really needs to be studied, and this trial has really done that. So that's
okay.
Good.
Okay, Dr. Pramesh, you wanted to make a point? Go ahead.
Yeah. So, Barkha, thank you for bringing the point out about why it took so long. So, for most of us who have done clinical trials in India, we realize that the maximum time that it takes to bring out the results is because it takes an awful lot of time trying to clean up the data, getting the publication out. So, I wouldn't discount this particular publication for the fact that it took so long, except for the point that we need to prioritize the importance of clinical research in India's healthcare scenario, which I think we're not doing enough. So we worked a lot towards implementation science, where trying to figure out what happens in other countries, whether it works in India. But I think prioritizing the importance of clinical research in India cannot be overemphasized. And that's one of the main reasons why the results of this trial actually took too long. If you look at many of the results from the recovery trial, for example, they came out with publications very quickly after their endpoint of the results. Whereas for Covaxin, it took a much longer time, and that's because we are not prepared to come out with results. The second point I wanted to make was with the question that you asked Dr. Rajeev about the fact that he had kind of predicted that this would be what the results would be. But I will take that with a caveat that in spite of all theoretical reasons why something should work, there are many reasons why in clinical trials they have been proven to be wrong. And I would personally emphasize the need to wait for clinical trial results before we roll it out in the public health scenario. We would be making a big mistake if we didn't wait for the results of clinical trials.
Fair enough, but now we're in a situation where the next step for this vaccine has to be approval from the World Health Organization. And the other question, Dr. Gilada, is the demand-supply mismatch. And with Covaxin in particular, the anecdotal evidence certainly is that it is easier today to get a Covishield vaccine than Covaxin. Now, if you look at the government of India affidavit in the Supreme Court, the government says that it has placed an order for 19 crore doses, but it's a little unclear how many doses have been received. The affidavit is quite contradictory. At one place, it talks about 8 crore doses. At another place, it talks about 2.8 crores, if I'm not wrong. Dr. Gilada, what do you think is happening in terms of supply?
I think everything is interdependent. Possibly government also, where they want to expand to a lot of other units where Covaxin can be manufactured, they must have been also waiting for the data to come out before investing in new setups in crores of vaccines. That is maybe one of the reasons. Secondly, when Covaxin was given a license and they had given a schedule of supply, the government should have questioned them in last 4 months that why you are not meeting the supply. Because initially, when 2 vaccines were launched, people thought that is a 50-50, 60-40 kind of partnership. But ultimately, it ended up initially as a 95%, 5%, and then 90/10. So, and Sputnik is nowhere. So basically, there has to be some mechanism to pull strings and ask them, why are you not doing that? If you are not able to do that, because it's a molecule developed by government lab, they could have already given this kind of patent to other companies and they could have manufactured. The other most important thing which is overlooked in this trial is one very good thing which has come is 30% people were already seropositive. And that we have been saying for last so many months that there are already people infected. So if 30% people, even the clinical trial at 25 setups, 25 centers all over the country are positive, that means so much of people are already infected. And therefore, we should make a strategy at this place not to give vaccine to those who are infected and provide vaccine to those who are uninfected. We can reach the herd.
You keep making this point. We can't even get the European Union to give us a green pass on our vaccines. If we want to re-enter the world with one vaccine, Dr. Gilada, who's going to listen to us?
No, but those who are insisting on vaccine, you give them. But you can tell them, like I tell my patient that you are already IgG positive, we wait for 3 months. Come back after 3 months. They come back after 3 months, they are positive. I said, you don't take vaccine, you wait for another 3 months. So they are doing that. And it is not a rocket science, it's a small 1-drop blood test. When you have such a big machinery of doing RT-PCR all over the country, the same person goes and just pricks and take 1 drop and say, you are already infected. You don't need vaccine right now. So and currently, when we have a shortage of vaccine, when you have plenty of vaccine, you don't need to do that.
Yeah, I think Dr. Pramesh wants to make a point briefly, and then I'll come to Shahid. That the problem with what Dr. Gilada is suggesting will have some practical issues. Dr. Pramesh, if you want to come in on that.
So I completely agree with Dr. Gilada, except for the fact that to get this information on reliable information on previous infection is a bit of a problem. So the ones who've been diagnosed COVID positive, it's less of an issue. But the asymptomatic, never diagnosed patients, having to subject every single individual who's a potential candidate for vaccination to an antibody test to see whether they have adequate antibodies, it's logistically a nightmare. So if you were to put in this additional hurdle to patients, to people getting vaccinated, I'm afraid that the scale of which we are able to increase the vaccination rates would seriously suffer.
So, Shahid Jameel, that's what I would like to now turn our attention to the supply that we can expect from Covaxin, which has been faltering so far, to the fact that our vaccination rates are certainly down from the record that was touched on the 21st of June, but that was expected. I think nobody thought that it could sustain at 86 lakhs. Are you concerned about the moving average thus far? It's quite clear that at this moving average, the government cannot meet its own target unless it is able to augment the supply side. What if anything, do these results tell us about how might the supply be augmented?
So Barkha, before I get to that, just one more point on the logistics. Many people don't realize how difficult it is to make Covaxin. One lot manufacturing takes 4 months. And this is a vaccine that has to be manufactured in biosafety level 3 conditions. This is we are dealing with an infectious virus here. You have to culture very large amounts of virus, uh, in a manufacturing situation, and that's not easy. It takes time. And the other point that Pramesh was saying, adding another bit of logistics to test everyone for antibodies, you'll come through all kinds of problems. What is the sensitivity of the test? If the test is not sensitive enough, you will be missing a lot of people. And so, India is a very complex country, and I always believe that the solutions that we propose should be very simple. Otherwise, complexity multiplies. So,
And you think this will be complicated because?
yes, this will be complicated because you're adding another layer of testing. At every vaccination center, you're adding another level of testing. So people will have to be tested for antibodies before they are given vaccines. It's going to be a logistics nightmare. It won't.
Okay.
It won't work.
I'll get
Uh,
I'll get Dr. Gilada to respond to this, but Dr. Sumaiya, if you want to come in on this, and also speak a little bit about your own Twitter thread on the Covaxin trial. I know we've been playing bits of it, but I think it would benefit our audience for you to expand on it as well.
Yeah, so what I'd like to add is I agree with Professor Jameel here because there is no guarantee that we'll always find the correct results with that rapid test. So we may or may not. And the second point that I think there's a Nature paper recently that focused on how quickly the body can produce antibodies that is going to save you from severe infections, and not producing antibodies. Like eventually you will produce antibodies if you have a healthy immune system, but the problem is that it might just take time, and that time taken in the middle is going to be it's going to tell you how severely you're going to get the infection, if you're going to get hospitalized or not. So if we don't get the infected person, if we don't get them a vaccine, it is very likely that the second time infection is also going to be deadly, and especially the case with the new
But are you saying reinfections are not an outlier phenomenon anymore? Because so far my understanding has been that you can get reinfected, but it's one, an outlier, two, you never really get reinfected in a serious way. I mean, am I wrong?
No, you can get moderate to severe infections if you get infected the second time. That is not completely sidelined. But also, I wanted to point out the data from the GUSID, the biggest data portal that suggests that the world now has about 85% of the Delta variant, and with the low vaccine efficacy on the Delta variant, and it's not just Covaxin, it is also Pfizer, it is also Moderna, it's also AstraZeneca. They don't perform as well with that Delta variant. That is a huge problem because they can get reinfected with another.
But may I contradict you just on that? Not contradict you, push back a little bit on that and say that if we look at the UK and the USA that have opened up, and in the UK the Delta variant is now very clearly spiraling the infection levels, but it is not leading to any corresponding wave in hospitalization and deaths. So the
Absolutely.
UK has remained open. So
Yeah.
while these vaccines don't seem to offer protection against infection, they do seem to offer protection against hospitalization.
Absolutely. I mean, Barkha, I'm not saying that they don't offer protection at all. There is a smaller protection. I mean, there's still a chance, a higher likelihood for you to get infected and for you to have even a moderate to severe infection, but it is still a chance. I'm not saying it's either or again. The fact that Delta variant is so deadly, the fact that we need to give more vaccinations regardless of that, we will still have small number of people who will get infected. And that is what we want to avoid. What I wonder, yes, you want me to go back to the actual thread where
Yes.
we talk about the outcomes. So, I mean, yes, of course, the efficacy is really good. It's 77.8%. Now, the symptomatic cases in particular, we are getting really good protection, 93.4. The asymptomatic protection is 63.6%, which is phenomenal because at the end of the day, Israel was removing masks. They had these, UK and Israel both had these advertisements from the government where they were taking off masks and, business was as usual. But that is not true. This is not something we can do, even with entire population being vaccinated, because there's still a chance that you will get infected. But again, with 63% protection against asymptomatic infections, that is still pretty good. Severe severe cases, obviously, 93.4% protection, which is you only have a small percentage where you will get severe cases with the Covaxin. But it's the same with other vaccines as well. No vaccine gives you 100% protection.
And this is at what, I'm sorry for asking a dumb question, this is at what gap between the two doses? Because that's been such a big debate, because there's been such a big debate with AstraZeneca.
I think the 12 to 16% is a good gap to have. I think more than 16% might be a bit too much, but we haven't really tested that as well. I mean, we don't really know that increasing the gap over 16% is going to give you better efficacy. But yes, 12 to 16% is very well documented. I think what India should do right now is, from the Ministry of Health, just like what NHS is doing, have week by week data coming out in real world efficacy comparing Covaxin and Covishield. I think that's really going to
I don't think you're going to see the government doing that, because the government's approach is please take whatever vaccine you get. So I don't think
in an ideal world. In an ideal world, this should what have happened, that week by week we come out with how many people getting the vaccine, how many people are being protected, and the real world data that really spikes up the trust in the vaccine.
Just before we get on to that, I think the important point here is that Covaxin has never been tested in a longer duration. The original trial with Covaxin had a 4-week interval, which was adhered to in most situations. So I don't think we have the data for Covaxin to support a longer interval between two doses. We do have reasonably good data.
This data, sir, Dr. Pramesh, just to clarify, this data is with a 4-week gap?
That's right. So the original trial, as well as the publication from the Bharat Biotech, has a 4-week interval. Whereas with the Oxford AstraZeneca vaccine, we have data on 4 weeks, 8 weeks, 12 weeks, and beyond 12 weeks, which clearly shows that if you prolong the interval, you get better. But currently, we don't have data with the Covaxin to support a longer interval.
So a 4-week gap makes supply and volume absolutely critical. So this takes us back to Dr. Gilada's point, which many of you have disagreed with. But then what's the other way? Dr. Gilada, before I come to Rajeev, and I do have to start taking, we have about 7-8 minutes left of the program. Dr. Gilada, do you want to respond to basically the panel saying that your suggestion is impractical? No. But on the other hand, if these results are with a 4-week gap, there needs to be a lot of Covaxin in the supply chain.
Barkha, just give me uninterrupted 2 minutes, because I am swimming against the current. I'm so surprised that Dr. Pramesh and Dr. Shahid saying that it is logistical nightmare. We had a logistical nightmare for RT-PCR. We had not more than 50 or 60 lab. We have now 10,000 plus lab. That is the most complex test we are doing in thousands and thousands. Secondly, we have a magic date of 31st of December, and we have magic figure of 188 crore doses. From where do we get it? And thirdly, if you are doing currently RT-PCR in thousands, where yield is 2.2%, and in antibody test, yield is 40 to 50%. Don't want to do antibody test where you are getting 50% of them positive. You want to do the test and spend a lot of money, energy, manpower, machinery for RT-PCR. So unless until you do that, and it's a point of care test, it's a one-drop test. You can have a self-deferral. You ask people, if you have been infected, don't come. If you have RT-PCR positive, don't come. If you have been admitted in hospital, don't come. If you want to get one drop blood test, get it done. Don't force them. By doing that, you can save 25-30% of doses currently, at least for 2 months. Because what your supply is going to be there, it will be post-August or post-September. So unless until we have that kind of supply, we are not able to meet the challenge. So, and secondly, if you have to blame, Zydus Cadila company. If you remember, on 22nd of July 2020, ICMR Director General made a statement that we'll have a vaccine on 15th of August 2020. And I thought that he has misread 21, and he said rather than 21-20. So the Zydus Cadila Zycode D has not come out. I don't know whether it will come out before 15th of August or not. Whether problem is there with Zycode D or with the DCGI, I don't know. So rather than blaming those people who are assuring and not coming out, and honoring, we should honor those people who are coming out. So we need to just augment the supply of Covaxin. They are going to have more and more center, but doing IgG test is, and it is 99% sensitive and specific. So as compared to
the reason that I think we need to spend some time on your proposal is that now that Dr. Pramesh has explained that this data is with a 4-week gap between the two doses, I just have to ask And I'll start taking last comments. I'll start with you, Rajeev. Where is the supply of Covaxin? Yes, I take Dr. Shahid's point that it's very complicated. I have with full respect to the complications. We have an imminent third wave. We are still only stabilizing the second wave. It's not over. Officially, we're still seeing more than 1,000 deaths a day. That is the recorded deaths. So we need more vaccines.
We do. We need more vaccines, because we should also remember that India is different from every other country in the world. We're one of the world's largest populations. So what applies to smaller nations, unfortunately, will not apply here. We should really have customized strategies. But what we do have here is, in terms of numbers, we've vaccinated a lot of people, but those numbers simply do not translate to percentages. And we all mostly agree to the fact that if you have a high percentage of people who've seroconverted, that's who've developed some form of immune response to this virus, vaccine-wise or infection-wise, they are less likely to have severe disease in the future. Knowing that this pandemic is going to have an infinite number of waves until it fades away, we're going to have maximum number of people come under the umbrella. So we really have to think out of the box and come up with a strategy, either increase the production or improve the distribution.
What do you think of Dr. Gilada's proposal?
Well, I think it's, personally, if you ask me, I think it's a reasonable suggestion, because you could have a fast tracking of previous exposure. There are some tests that are rapid tests that can pick up a fair number of antibodies. If you're negative, you could go in and get the vaccine. If you're positive, maybe you could have a separate strategy for them, because if you've been previously exposed I heard what Dr. Shaikh said, but clearly the consensus says that your second infection, it will be milder or asymptomatic for the most part. Clearly, there are exceptions. There are a few severe cases, but really speaking, if you've been exposed in the past, you can expect a milder disease. So
my bigger concern is not on reinfections with respect to the point that Dr. Sumaiya made, but with the fact that the world has to have a uniform policy in the end, because we are living in an interconnected world, right? So we've already seen the struggle with this EU green signaling for Covishield, and now, by the way, 5 million British citizens who also got AstraZeneca manufactured in India are also struggling. So it brings home the fact that you need a kind of broad set of global agreements. Last comments, Dr. Pramesh, I'll start with you. If it's at a 4-week gap, where's the supply going to come from? Covaxin supply has already been a bit of an issue.
So I think if you look at the ground level, we are oversimplifying things. Supply is less of an issue than vaccine hesitancy or
even
vaccine. Even now. So today we had the capacity at our own center to vaccinate 800 people, and we had 350 people landing up at the center. So it's less a question of availability as it is of making sure that we disseminate information reliably. But I will go a step further and go on to the point of vaccine inequity, which I feel very strongly about. I think as a global community, we have failed, and we have failed abysmally. We have high-income countries going out and hoarding vaccines when several countries, and I will not use India as an example. If you look at Africa, that's a continent which is desperately looking for vaccines, and we don't have the ability to supply them with them. And if we were to get to a situation of vaccine equity, that's the single most important point that we would come to, rather than look at how can we shore up vaccine. I'm not for a moment suggesting that we don't need to scale up manufacturing. We definitely need to do that. But I think it's more a question of ensuring vaccine equity rather than anything else that is at the core of the matter.
Shahid, do you want to take the last word before we close?
Well, we seem to be forgetting that what we didn't do was order enough vaccines on time. If the turnaround time for Covaxin, one lot to manufacture, is 4 months, they need to have advance purchase orders. Every single country that is vaccine sufficient ordered vaccines in August, September of last year. We ordered in January of this year. So that's really the core issue. We haven't ordered vaccines.
So what do we do now? We know this. Now what? We're in this mess because of that. Now what?
Now what? The real world data shows that even one dose offers protection up to 70%. Go
Yes,
with that
and
data. Go with that data, and vaccinate as many people with one dose as possible till the supply eases out. It will ease
okay.
out.
So Maya, quickly on the variants, I think you wanted to make a point. Yeah.
Yes, I do. I think Bharat Biotech mentioned in their paper that they had tested on the Delta variant, but they also put it in in their method section that they did the recruitment between the 16th of November and the 7th of January. Now, what that means is, were they actually testing on the variant at that particular period, or was it after? So I think there's a confusion over there, and a lot of people are also asking because they've
I
not
think,
mentioned when
yeah.
they recruited for testing the particular Delta
Shahid,
variant.
Shahid, can you explain? I think you
Yes.
were looking. Yeah. Yeah.
Recruit
Yeah.
the recruitment time there was no delta, but after the vaccination, when
Sorry, there was Delta
people,
since October, so that's
well,
Yeah,
no,
but not
no,
identified in
Sumaiya,
clusters of 130.
that
Yeah.
information is wrong. Delta was first really emerged in the country in February, March. Before that, it was B1617. There was no B1617.2, and that is Delta. Delta is B1617.2.
So
And
what was
we have very clear data from INSACOG to show that Delta started emerging only in March. It was not there earlier. So what they are seeing efficacy against Delta is that everyone who came to be symptomatic in a trial was RT-PCR, and that's how they, oh, sorry,
okay?
was
I'm
sequenced.
confused. I'm
Was
also
sequenced.
confused now because if they were recruited earlier, then how did they all get? If they were recruited between
So,
October
Barkha,
or
they were
November and
recruited.
January, how did they all have Delta?
Barkha, just give me a minute. They were recruited. They were given the vaccine. And after given the vaccine, they were followed up to see
I
who
see.
gets infected. And people who got infected were then sequenced and found out who had Delta. So that's how you find efficacy against Delta.
Okay, fair enough. Dr. Pramesh, would you like a closing thought? Can we unmute Dr. Pramesh? Yeah.
Yeah, so I completely agree with Shahid. So though the recruitment was done at a time when Delta was not the dominant variant at the time, what it did was demonstrate that when the infection actually happened, it did protect against Delta as well. Not nearly to the same extent that it did with the Alpha variant, but I mean, you could argue percentages and we could go on for hours together on that. But I think the important point to realize here is that even with the Delta, it provided close to a two-thirds or a 66 or 65% protection, which is as good as it can get. So
Yeah.
I'll be happy with that. And my only uh, earnest appeal to all the people of India would be to get vaccinated at the earliest with whatever vaccine you get. Now that we have phase 3 data on all the vaccines that are available here, to ensure that we kind of contain the spread and ensure that whatever we are faced with is something that we can handle. So go ahead
Yeah.
and vaccinate yourself.
Absolutely, and I'm actually really shocked, Dr. Pramesh, to hear that your center had 800 vaccines and they were not fully utilized today. That is an instructive piece of data, and I actually think it's absolutely criminal those who have access to vaccines and are not using them. Because if you go into the interiors and you go into rural India, people want to be vaccinated, and there are no vaccines yet and available in an equitable way. So given that irony, a vaccine right now is a privilege in India, and it would really be morally indefensible, in my opinion, to not take the vaccine. We're leaving it there. Dr. Pramesh, Dr. Shahid Jameel, Dr. Sumaiya, Dr. Rajeev, and Dr. Gilada. Pleasure to our audience. Again, please get vaccinated if you have access to a vaccine. Thank you for watching, and see you again tomorrow. Goodbye.
It's great to see you here. Thank you for watching our work. If you haven't subscribed yet, don't forget to click the bell icon and subscribe to Mojo Story and support independent, robust journalism.